I'm Dr. Rajkissor. I am in partnership with Dr. M.J. Vanmari.
My name is Dr. Vanmari. We have fully incorporated practice. It's a fairly busy practice. You've got to be passionate about it. Although it's a private practice, we are community-based. A disadvantaged community who are not serviced fully by the provincial hospitals. And this practice has grown exponentially. We see a broad spectrum in terms of ages, from little newborns right up to 80, 90-year-old patients. And it's an affordable, accessible service. So we cater for our patients.
So within a small budget, we are able to diagnose, treat, give an injection, give medication, do some minor tests like urine tests, pregnancy tests. I think for most doctors, they would rather see patients than be involved in admin. So with a program like HealthBridge, and you have the trained staff to handle the program, it assists us in delegating that aspect to the staff. So we are able to concentrate on patients without a cloud in our mind, knowing that the account is going to get paid. We can treat the patient quicker. The staff at HealthBridge have a genuine interest in our business. When you got a problem and we call them out, especially Asogran, when you got a problem and call him, he's there. He spends time with you. What I noticed about HealthBridge is they take an interest in your practice. So it's almost like they are partners in the practice. It's more they care about your practice. When we used to dispense to a patient, we had no way of knowing that the claim is going to go through within a short space of time. Within a week or 2 weeks, we had no idea. When we did make scripts for patients, they will go to a chemist. And they had that program where the chemist would know immediately. And with the HealthBridge, we are getting that service.
HealthBridge makes my administration of the practice much easier in terms of submission of claims, reconciliation of claims, and checking patient benefits.
It offers us certainty. We don't have to guess, we don't have to hesitate when we see a patient. While the patient is in our rooms, we've treated the patient, we are able to run the account through immediately and get an immediate response. So it helps us with the communication to the patient. We can tell the patient what the medical aid is paying for or what is being rejected, so the patient can understand immediately. Our medical aid patients are happier. The other value is the financial aspect. We get paid quicker, so it helps our cash flow. There has been a significant reduction in our bad debt.
It gives me less financial stress, which is very important to every practice. I can concentrate now on paying real attention to my patients, concentrating on the patients. I don't worry about medical aid claims and chasing patients, unpaid accounts, things like that. I can concentrate purely on my patients. It gives me a lot of pleasure to treat my patients, to see them come back again, to see their smiles when they're leaving, their happiness or their pleasure when they're leaving, and to see them again.
When a patient you've treated, you know how sick they was, and they walk through the door and with a smile on their face. That is very rewarding.